Welcome to Unraveling the Brain. I'm your host, Dr. Josh Madsen. Today, me and Dr. Loren are talking about all things photobiomodulation or laser therapy. We're going to talk about how we use it in the office. We're going to talk about different waveforms, what they do, how they work, why they work for different things, and share some research that we've read recently as well about that. And then also, if it's something that you're wanting to do from home or you're a provider that's wanting to do it, how you can get involved. So let's jump into it. Okay, I want to talk about, first things first is, let's talk about the different waveforms, infrared versus red versus violet and green, and kind of what they do and maybe some application for it. So let's start there.
Sure. Well, the cool thing about each of these lasers is they're coming with at least 2 wavelengths on each laser, which is awesome. It's a massive benefit because different wavelengths penetrate different depths. They provide different levels of energy, and they influence cells in slightly different ways, where violet is a little bit more anti-inflammatory, helps like calm the brain, where red and infrared are really great for energy production and just like allowing neurons to be strong and stable and function at a high level. And so really depending on the ailment, the delay, the dysfunction, the, whatever
Depth of penetration you're trying to get.
Yep. Then you can use the lasers to be even more specific to whatever you want to work on. So,
yeah. Yep. So basic things to talk about here so like when you look at, like red or violet, red, and then infrared. So when I explain this to a patient, how I say is red is a waveform that's a lot taller. So it can't penetrate as deep into the skin. So it can only go like, from different research, it can't go nearly as deep as like a red or an infrared. And red, instead of being so tall, it doesn't have as much height, and so it can get deeper into tissues. And infrared is a lot lower waveform, or like a lot lower peaks and valleys, so it can actually penetrate a lot deeper. So like if we're trying to get all the way to the brain, a lot of times we're using infrared or maybe red. If we're trying to have more of an effect on tissues that are closer to the skin, or maybe not having to go through bone as much, we're using more red and violet. Not saying those can't get to the brain, because they definitely can, but just not to the same extent. So that's kind of an important thing to think about when you're looking at using lasers as maybe a provider, is like, what am I trying to help with? What areas am I trying to penetrate to? And that's why in our office we use so many different waveforms, is because we want to use infrared to get all the way to the brain at certain points, but then we want to use violet at certain points because that's been shown in research to increase GABA production or calm the brain, or it's been shown to increase density of Purkinje cells in the cerebellum. So we can use different waveforms to do different things. And it also depends on the thickness of the skull, like if you're doing transcranial, or the thickness of the tissue you're trying to go through, because like you need a certain amount of power to get through those. And when it comes to power, the nice thing about an Avant is you can bring it all the way up to a class 4 laser. You can bring it all the way down to a level 2 laser. Like you can variate the power so much depending on what you're trying to do.
Yeah, power and coherence. So
Yeah.
all photons are therapeutic. Not all photons can get into the tissues that you want it. So you need the right wavelengths, the right amount of power, and for that light to be all that energy pointing in one direction. So that's where you get that penetration. So a lot of people, we're doing red light therapy, or you can buy devices on Amazon for $150, but that's an LED. Those photons just scatter everywhere. You might get a little bit into your skin, but like, there's no coherence. There's limited power. The pulse and like all those like important variables are really lacking on those devices.
And
So
with that, like, I mean, a lot of them are, 10 milliwatts per centimeter squared, or maybe up to 30 milliwatts per centimeter squared, which means with that amount of power, you're only going to get 3 to 5 centimeters into the skin. Like you're not going to get the depth, which it still has an effect. It has a positive effect on mitochondria in your skin, which is going to have also, there's some secondary and tertiary responses that happen with that. So we're not saying don't do those things. Like I have a panel at home. It's great. It's just not going to get the depth you need for transcranial use, or for deeper structures in the body, or to get to the gut. You really got to have some power to do it, to be honest.
I'd say, just like generally speaking, the violet, more of like a brain calming frequency, where the red would be more of like, or infrared, would be more of a brain stimulating. So kids with genetic conditions, or movement delays, or like even older adults with tremors or just chronic inflammation, and like just wanting to get in there and activate cells and get deeper penetration, more energy production in those cells. Significant benefits with that infrared and red. And then from a brain calming standpoint, violet really goes a long ways, and it's through that GABA. It's just creating stability in cells. Neurons need to be stable. So you can really benefit from photobiomodulation from two major sources: decrease inflammation, increase energy production. When you're able to do both of those things, significant improvements. And then also just simply bringing more blood flow. More blood flow means more oxygen. More oxygen means more energy production. More blood flow means more nutrients to the cell, getting metabolites away from a cell. Just even activation of stem cells. Like kids with developing brains, like these can help activate stem cells to produce more productive neurons to allow the brain to develop more appropriately.
Yeah, and they've been shown to create neurogenesis, so new neurons, generation of new neurons, which is honestly is unreal. It's super cool.
Increase in dopamine, increase in serotonin. Like there are so many layers of benefits to lasers, and they've been out such a long time.
Yeah,
Like
huge, awesome
60
safety
years.
profile. Like it's crazy.
Especially with the right laser. So like
Yeah.
you have to have enough power to get in, but not too much power where you're heating or damaging tissues. And like, these really fit that bill. They really find that sweet spot between enough power but not too much, and which are both obviously incredibly important. There's a lot of other lasers out there that are just much less power, and we've used those. And just didn't see
Same results.
No, didn't see a significant of change. And running these or using these on hundreds and thousands of different kids, and just no adverse effects. The literature shows no adverse effects other than just like improvement. I tell everyone, you can search photobiomodulation, which is the technical term for therapy use, and X, Y, or Z, and X, Y, and Z always improve. Like dementia, Parkinson's, Alzheimer's. Like the improvements with laser are so or the benefits are so universal that nearly any condition can benefit through increased production of energy, better mitochondrial health, better stability of cells, better cell health. And so it's just, it boggles my mind that more people aren't using them.
Right.
Like I was first exposed to these, when you brought them to a conference. I thought it was like the coolest thing ever. You had like lasers in a carrying case, and I was like, oh, that's so sweet. But then I was also, like, right out of school, I was shadowing a doc that was doing a lot of really cool stuff for neurodegeneration and neurodevelopment, just seeing like a really wide spectrum of kids. And so people with neuropathy and people with just chronic pain, he was using Avance on, and he was working on a balance with a kid, and the kid could not balance. And then he threw an Avant on a stand, had red on his cerebellum, and all of a sudden balance just like immediately, like something clicked, like immediately. And I was just like blown away with like the instant improvement in that. And we see kids that have been working on reflexes for 5 years, sometimes more, and they'll come in and their reflexes are as strong as they were when they were probably an infant, if not stronger sometimes. And just getting enough energy to their brain, creating enough stability in those neurons, then all of a sudden their brain communicates at a higher level. You're able to inhibit those reflexes. You're able to put their central nervous system in a place where they can develop and grow and build on those fundamental skills. And
yeah, I mean, how many times has it happened where like they're like, yeah, we've been working on reflexes for a year or 2 years or 3 years, and within 15 minutes of being in the office, the reflexes are gone.
Yep.
Just simply by getting enough energy to the brain for it to do what it was intended to do.
And that's the benefit of an intensive, is like it gives us enough time to provide stimulation. It gives us enough time to provide support with laser, give them oxygen, sequence their care appropriately. And it's also a benefit to have one at home. Like they can do it frequently.
Every day.
They can do it frequently enough to continue to benefit from it. And our video has shown, relayed the information found in that research review, and the improvements from laser are maintained for 12 months. So that gives kids just a massive window to just decrease stress to their system, improve the function of their system,
Continue to develop.
And we hear that, we get positive feedback all the time from kids that do intensives, and they make a lot of progress while they're here, but really, like, kids will develop continually outside of here, especially when they're able to get a laser and use
Yeah,
it.
use it at home.
Yep. And do
Yeah.
all the nutritional and all the exercises and just like all the lifestyle modifications just to put them in a position to heal and grow.
Yeah. So let's, 100%. Let's talk about what lasers we use for different conditions and why. First one that we see the most, and we'll do this pretty general for like, so it's not just pediatric related. If you're another doctor that's watching this and maybe you do musculoskeletal stuff, we'll talk about that too. But from a, let's talk about autism first, PANDAS, neuroautoimmune disorders. What would be your go-to laser?
We can't go wrong with any of them. But if you had to choose one, like, and the research on violet and blue, which are right there on the wavelength spectrum, shows that really there's anti-inflammatory benefits or massive anti-inflammatory benefits of those. And you touch on it, GABA ergic activity. GABA is a brain calming neurotransmitter. It brings stability to cells. It makes them less spontaneous. And so when you're trying to calm the brain, trying to drive down inflammation, modulate immune function, or decrease, autoimmunity, violet really, really does very well with that. And cool.
And we noticed that too. Like I didn't have violet until probably a yearish ago, maybe a little bit less. And the extreme difference in how fast we can get a kid to calm down in the office, and we can get them to start opening up and like having nonverbal communication and verbal communication, and they're start making eye contact and interacting with other people. I mean, it's within a lot of times within a few days, which is unreal. But I did not get anywhere near those changes before we started using violet.
Yep. Well, I think everyone in the office noticed that. Like all the therapists, all the doctors were just like, man, these things are different. Like these things are just, they're making change faster than anything we've seen before. And like, just for example, you had a young boy that he was on my schedule for an exam, wouldn't even come in for the exam. Didn't even come to the office. Like he was in a flare, like just behavior was crumbling outside the office. You got him to come in, you did your exam, you worked with him and lasered him on violet and just got him to calm down. Like the rest of the week was like, he was some of our therapists and some of our doctors' favorite patients to work with because he did so well. But you gave him a window to calm himself. You gave him an opportunity to regulate. And that was so cool to see. And just from like stims and tics and repetitive movements and just like repetitive thoughts even, and anxiety, and like the violet goes a long ways. And so the cool thing about it, and like most research is going to show infrared and red because they get in, they go deeper based off the more linear wavelengths, but violet has to be getting in. Like there's not a lot of research out there because they're new lasers. Like they're like, just from like a manufacturer standpoint, they haven't been around as long. But
we didn't even know why. Like we've been using them. We didn't even know why they made that effect until probably like I just saw a study a month ago on a rat model that showed what it does for GABA and stuff like that. We're like, oh my gosh, well that makes perfect sense. But again, it's new. Like we don't know a lot of those effects yet, and I think that's going to be a really cool thing to see over the next 5-10 years as they become more and more popular.
And so you've been using infrared and red and making huge changes over the last better part of a decade. And you've been running one of the biggest studies on lasers and developmental conditions that compared to anyone. Like and that's all observational, anecdotal, but that stuff's still powerful, man. Like the stuff that you and our staff has gathered and the information and like all of that, it goes a long ways. That's bigger than any research study that's out there right now. And so just like everyone that has experience working with these kids has experience working with these lasers, and then just being able to monitor and show change and observe change, and develop an opinion and develop outcomes and protocols, and be able to provide that guidance to other providers and to parents, and like that experience is huge. And so like there's nothing on paper, but like there's a lot of improvement happening.
Yeah. And the other doctors that now we're training and teaching them how to use these, they're seeing the same thing. So it's not like it's like, oh, I just randomly found this, thing and it works just for us. Like all these other providers, they're like, oh my gosh, Violet's calming their system down so fast.
Yeah.
for sure. So from the standpoint of like autism, we highly recommend using a Revi or a red violet because of that mechanism. And if you have the choice to do all three waveforms, well, now you get the calming effect of the violet. Now you get red, which gets deeper, and now you can even get infrared in there, and you can have a deeper, more effective activation of the brain with that is what we typically see. Um, and that's the same thing with PANDAS too. Like one of the cases he was talking about, I had this kid come in that he was in my exam room and he was screaming profanities at me. He was hitting me, kicking me like crazy. I couldn't even do an exam. He was in a flare. He was just in a massive neuroautoimmune flare, and lasered him with violet over different areas of his brain and over his, different areas. The only thing I could do with him for 30 minutes, pretty much straight, like just hitting multiple different areas. And within 30 minutes, we could do anything we wanted with him. He was super chill. He's out of his flare. He's calm. And then we could do an exam. We were able to start doing treatment. And then the next day he came back. Same thing. He was in a flare. We lasered him, but this time it only took 5 minutes, 10 minutes. The next day it took 5. The following day he came back and he was calm. And so like that consistency over time is huge. What if we're dealing with a kid that has, what's your favorite laser for any type of pain syndrome? Or let's say an adult or a kid that has maybe a pain syndrome, or maybe they have chronic low back pain. Maybe they have chronic joint pain. Like just thinking of your general chiropractic office, what would be the most ideal one to go with, do you think?
For adults, generally default towards, like, unless they have autoimmunity or, toxic exposure or mycotoxin issues, or that's a lot of people.
Right.
And,
yeah.
But for adults, generally pain modulation, infrared and red. I mean, I often overlook red, but red's amazing. Like red is just
huge
like
amount of research.
Steady Eddie. Like it's just good at everything. Like it's just like, so I always ask like our therapists are like, what's your favorite wavelength? And like sometimes like infrared's so cool because the penetration is so deep, and violet's so cool for what it does, but red is just like
90% of the time you walk around the office and it's red.
Yeah, and it's right in between those two wavelengths. Like just like, and so there's a lot of carryover with each wavelength, really culminating in red. So if I had to pick one, red. And that's the cool thing, you get red on each laser.
Yeah.
I tweaked my low back the other day. I was like at the park with my kids. I went under something and just like tweaked my low back. And while I was working on a kid, I took a red and infrared, put it on infrared, put it right where it hurt. Like 5 minutes later, I had no muscle spasm, no nerve pain. Like it's just like completely relieved that. Yeah. And so like, spinal cord on a large man, like I'm going to get in there. I'm going to get the infrared deep.
Yeah.
I'm going to affect this.
Get penetration as quickly as possible.
Get through all these bones and get through all like the little muscle I have. It's just like get in there and do what I can. And it's made improvements within minutes.
Yeah.
And so again, huge benefit of being able to do that every day. I love having one at home. So when my kids jump or they fight and someone whacks their head, I'm right on there following up with a laser just to calm inflammation.
Yep. And there's lots of research that shows that like if you have laser right after a concussion, the effects of the concussion are like super minimal in comparison to all the gliosis and neural inflammation that happens. But they found like this is done in rat models because you can't really just give someone a concussion and then go and laser their brain and then take a biopsy, see what happens. But what they did is they took biopsies, then they gave them a concussion, did biopsies, then they lasered them and did biopsies again and showed the difference between what happens when you have a concussion and laser versus what you don't. The long-term effects were extremely minimal or not even present in comparison to the ones that didn't. When they had a concussion, they had long-term challenges and effects and cognitive issues, and these mice couldn't, do all the planning and testing that they normally are able to do. They couldn't do after a concussion, but if they had photobiomodulation, they could.
Even post-stroke.
Yeah, post-stroke stuff too.
Well, that's interesting you mentioned that. In that fall, we see a lot of kids, local kids that are, well-developed. They're on the flag football team. They're on the football team. They come in with a concussion. All of a sudden, they have primitive reflexes. They have eye tracking issues. They have behavioral issues. They have anxieties that come up, and their brain's injured, and they're not able to regulate, and they're not able to integrate sensory information properly. And so, like, depending on the area of the brain, a lot of times you'll see reflexes associated with the injured part of the brain. And so being able to use a laser to minimize those negative effects from a concussion and help the brain heal and take a stressor away from the brain while it's healing. That's a
It's huge.
yeah, it's super huge.
I mean, it's almost the point now where a kid comes with a concussion and it's like, well, for the first three weeks, we're literally just going to laser them. And most of the time you recheck a lot of those positive neurological findings and they're not there anymore. They're just, the brain healed on its own after getting enough resources to do that.
Yep. Well, and one of the worst things for a developing brain are those repetitive head traumas. Just kids learning to walk, bang, bang, kids with older siblings, kids hitting their head at the park, and being able to follow up that day with a laser or come in and get a course of care where you're really focused and you have a team to laser and work through the proper neurological progression to rehab appropriately. Like those two treatment modalities, laser and appropriate sequencing of stimulus and exercise, those are massively important for neurological development long term. Like where we have brain injury, we're more susceptible to neurodegenerative conditions as we age, and so being able to minimize that brain injury effect even helps a kid 50 years later when they're an adult and their brain
For sure.
starts to age.
For sure.
And it's neuroprotection.
Yeah.
Parkinson's, Alzheimer's, dementia, like those are energy production issues.
100%.
And when you get more energy production by putting photons in where you want it, you're not curing Parkinson's, you're not curing dementia, you're not curing Alzheimer's, but you're slowing down that degenerative process.
And making huge functional changes is what all the research shows. And this isn't just us saying like that. We don't even deal with that population that much, but from a research standpoint, when you look at that, it's, like whenever an elderly person has Alzheimer's or dementia, it's a mechanism or a therapeutic strategy that can be used that there is no other therapeutic strategy besides diet and lifestyle stuff that can address. And that's the cool thing about these is for all of these underlying brain energy production issues like Alzheimer's, like autism, like developmental issues, there's nothing else that addresses all those underlying mechanisms like a laser does. And that's what the research is showing over and over and over and over again, is that they can be used for so many different things. And there's so many PhD researchers say any brain-related disorder, no matter what it is, should use photobiomodulation first because it's effective for those by addressing those underlying mechanisms, number one. But then number two, there's no side effects.
No.
Which is awesome.
Nope.
Okay, if someone wants to get a laser, tell them the process through Infinity Lasers.
Yep.
What happens?
That's been a big deal, and the feedback's been really good from that. Just like we're able to ship these things worldwide. I'm shipping one out to Wales today, and so really the process is scheduling a phone consult with one of us. So sitting down, like talking through their goals, any health concerns, like talking through a child's development, and figuring out which laser based off of our experience is going to be most beneficial for them. So a lot of people have a gut feeling. They've seen a bunch of they've seen a lot of videos. They can watch this video and learn a lot and kind of steer their direction.
Yep.
So,
and a lot of times people that they can't come here for a lot of different reasons.
Mm-hmm.
Maybe their kid can't fly. Maybe they don't have an option for any of this at home. Maybe they have a great therapist at home, but they want to incorporate more tools that can increase their progression much faster.
Yeah, a lot of people like kids of like immune suppression issues, or like kids that like literally cannot travel, or like they're so severe, or like they can't get a visa or a passport or whatever it is. And so yeah, coming for an intensive to like deep dive, obviously a huge benefit, but having a laser at home also very beneficial. And so talking through to one of us, figuring out which laser is going to be best, and then from there we can send a neurological exam that parents or even people can just provide or can perform at home. They can fill out the form. We can check reflexes. We can look at eye tracking. We can look at posture. We can look at facial symmetry, evaluate muscle tone just based off of videos and home exam. And then from there, we can interpret those results and then provide a specific laser plan for a specific laser, and then be able to manage those cases long term, be able to troubleshoot and answer questions. And hey, dad wants to use it for his achy back, or mom has some
thyroid autoimmunity or something like that.
or just like mental fatigue or something like
Yeah.
that. And being able to consult and provide information on that really is a benefit of buying through us. So you can buy these lasers from a handful of other sources, but our understanding, our experience, our interpretation, our plan, our training. So we provide video training on how to use them, how to set a laser up, how, like, where to point them, what angle, what distance, so how far away you need to be, and how long, and all those parameters. Like, we provide the input, and that's all based off of research, like the numerous articles that both of us have read, paired with our experience, and that combination is really effective. And so there's a lot of, different lasers out there, and you just kind of buy them and kind of troubleshoot on your own. And but like when you get a specific plan from, like, written by us, that's based off of really up to hundreds of different information gathering
Yeah,
pieces.
hundreds of different patients with us using these specific ones. And I've used a lot of different lasers over time. Like, I mean, a lot of different ones. We've tried multiple different ones, but we always come back to these ones. We always come back because they're super easy to use. They're super effective. They have settings for everything. I'm like literally 300 and some settings in them. They come with a massive manual that shows how to use it for those settings. So if they do want to use it for something else, there's a manual on exactly how to use it for that, which is so nice. And
They're reliable.
they're reliable. I've had my first one I've had for 7 years. It's been dropped hundreds of times. I've never once had to have any of them sent in for anything, and they work every single day. They hold the charge all day.
Yeah.
I've never once had an issue with it.
Yep.
I've never even had to have it sent in for a diode to be replaced or anything. And I can definitely not say that about any other lasers we use.
Sure. When the warranties at least double really any other
Yeah.
laser, made in the U.S. Like, we know the owners.
Yeah,
They're
personally.
they're just a great company. It's a great device. Like, our staff takes them home over the weekends. Like, these things get run every single day, year round. Like, if they're not working here on our patients, I'm using them on my kids at home.
Yeah,
Like,
me too.
our staff takes them home, uses on their self. If they have kids, they use them on their kids. When my in-laws come, my mother-in-law had a shoulder issue and just has like massive pain, and she's able to laser her shoulder and just get some relief there. Just like, everything benefits from laser.
That's why it's called photobiomodulation. It modulates the body through photons. Like, it helps modulate the whole system. When there's weaknesses, it makes improvements. When there's overactive areas, it decreases overactivity. So it just literally, it modulates everything and makes it function so much better.
Yep. They're not magic, but they're close too. Like,
Yeah, it's cool.
They're so versatile. And we see so many different kids from, massive neuroautoimmunity, or just like really autistic kids, or kids that aren't walking that should be, and everyone responds well. Even like adults, Parkinson's, like that's not our like primary clientele, but like people with tremors or dystonia or neuroautoimmunity, and just like,
They all respond so well.
Yep.
It's crazy.
Yep.
Cool. Well, hope that gives you guys a lot of information for today. If you guys need anything from us, just let us know. I hope this helps your providers out. If you're interested in purchasing one, just let us know. You can reach out to us at iowainfinitylasers.com. You can request an appointment to chat with one of us as well through that if you're interested. And have an awesome day.